Hi, I'm David Spring with the Washington Family Rights Coalition. This is the ninth of 12 sessions presented at the FTC workshop on July 9th, 2025. In this session, we hear from a second panel of trans cult victims and their parents. These stories are truly heartbreaking, but it is important to understand firsthand the horrific harm being inflicted by the trans drug cult. Here's the second panel of trans cult victims and their parents.
Now we're going to move to a very important conversations with parents and survivors. Earlier, Chairman Ferguson had the opportunity to hear about the harrowing personal experiences from Claire Abernathy, Kayla Lovedahl, Simon Amaya Price, and Gareth Amaya Price, and the truly heartbreaking story of Elvira Syed about the tragic loss of her daughter. There are too many of these stories. Please join me right now as we welcome to the stage Prisha Mosley, Soren Aldacco, Beth Bourne, Forrest Smith, Helen Spiegel Lee, and Gwen Turecki. We're going to invite these individuals to the stage. I'm not going to introduce them all beforehand, because as part of this, you guys will see they're actually going to be introducing themselves and giving some of their stories as well. Yeah, a round of applause. Thank you. Great. To get started, I would just like to jump into it. There's not much I can say that wouldn't detract from the personal experiences that you guys have had. And so to just start off, Prisha, I would love to give you the floor.
Hello. Okay. Thank you very much for having us here and for listening to our stories. My name is Prisha Mosley. I'm a 27-year-old detransitioner and mother. I am also a victim of medical fraud and abuse. When I was a teenager, my doctors lied to me, and as a result, I was medically harmed and defrauded. I was a struggling girl suffering with mental illnesses and with multiple comorbidities, including panic attacks, depression, and borderline personality disorder. I experienced a sexual assault as a minor, which made me fear being a woman. I learned about trans online on Tumblr. I felt that I identified with what I read online. I hated myself, I couldn't eat, I struggled to look at my body, and I self-harmed. This must mean that I was trans. When I brought this to my nutritionist, who was treating me for anorexia, I was immediately introduced to a pediatric endocrinologist who agreed that I had been born in the wrong body and needed medicalization. I was 16 years old and my body was perfectly healthy. No one cared that I had trauma associated with being female or that I hated my body and had delusions about how it looked. As soon as I said the word trans, all medical ethics went out of the window. I was convinced by the endocrinologist that I had a medical condition. I was led to believe that I had a male brain trapped inside of a female body and that this incongruence would ultimately lead to my death by suicide. I was told that it was a form of intersex. It was under the guise of these lies that I was referred to a woman for a letter of recommendation to begin testosterone injections. After suing her for fraud, I discovered that she was not even licensed as a doctor or a therapist. She was simply a woman who decided that my healthy female body was wrong. In the letter she wrote for me, she did not mention that I was unable to eat, often for days in a row, or that I was on a number of psychiatric medications. Instead, she affirmed that I was born in the wrong body and needed to be administered wrong sex hormones in order to stop my mental suffering and continue living. She asked my parents if they would rather have a dead daughter or a living son. I believed that I would die without transition. Medicaid was billed to cover my testosterone injections under endocrine disorder unspecified, even though nothing was wrong with my endocrine system. Now my healthy functioning has been taken away and I cannot regulate my own hormones. Testosterone did not improve my mental state but worsened it. I was put on more psychiatric medication and given muscle relaxers to deal with the side effects. Cutting episodes worsened. No one told me that testosterone was the cause of the cysts on my ovaries. I was told when I complained about pain that I was going through male puberty, which is something a teenage girl cannot do. My body was falling apart and my doctors gaslit me and told me that it was good. Testosterone mutilated my genitals before I could legally consent to sex as an adult. I was lied to about the effects it would have, and I suffer with atrophy and disfigurement and pain. I have never had sex as an adult with a normal, healthy vagina. I didn't understand what was being taken away from me when I gave consent. I was too young, and I was not being given accurate medical information. My consent was stolen. A year after starting the testosterone injections, I was led to believe by activists and my doctors that I needed to remove my healthy breasts. I was told that they were causing my continuing mental distress and that I would feel relief when my body was modified. No mental illness can actually be cured by cosmetic surgery. I suffered severe surgical complications as a result of giving birth. The papers I signed said that I may have trouble breastfeeding, concealing the reality that my chest is surgically sealed shut. My nipples were grafted and reattached in the wrong spot, and now they are just decorative. I was unable to breastfeed my baby the milk that came in. I had no idea that I had breast tissue left inside of me or that this was possible. It was the worst pain and heartbreak I have ever felt. I wanted to die. It is impossible to change sex, but I was led by my doctors to believe not only that I could, but that I needed to do so to live. No mental illness or mental suffering can be relieved by making cosmetic changes to the secondary sex characteristics, but this is the treatment that my doctors offered me and no alternative. I was never given any other option. My doctors never used real medical terminology. They tricked me using euphemisms like top surgery and with pseudoscience like the genderbread man. I genuinely believed that I needed drugs and surgery despite the fact that my body was healthy and I just hated myself. My doctors defrauded me. I am not alone. No human changes sex or is benefited by the purposeful disruption of their endocrine system or the removal of their healthy body parts.
Prisha, thank you so much for that. I don't want to pry too much, but can I ask your child's name?
Unfortunately, I can't share his name because I actually got threats on my children for the fact that I showed up here today to do this.
Wow, I'm so sorry, Prisha. Well, thank you for sharing that. Soren?
First, I want to say I love Prisha. Thank you for sharing all of that. My name is Soren Aldacco. I am a 23-year-old woman from Texas, born and raised in the suburbs, the urban sprawl between Dallas and Fort Worth, but now I live in Austin, where I just graduated with my bachelor's degree, and I now study how the internet is influencing identity formation. And thank you. With that, I speak on behalf of myself today as someone who began transitioning socially at age 11, was on the internet, chronically online, like a lot of people my age were and are. And that's where I was first, like I said, exposed to the idea that I could be born in the wrong body and that surgically and medically altering my body might be a good fix for my mental health conditions or my discomfort generally with that body, which was changing, right? Which is pretty normal for puberty. But that was mostly a role play identity, something that I used as a framework for developing a sense of self until age 15 when I met my biological father for the first time. I went inpatient. I had a little bit of a mental break, as I'm sure many people would have, meeting their biological father through Facebook for the first time. And while inpatient, the doctor picked up on the fact that I bound my chest and I went by a different name than what was on my record. And he pushed me until I told him, finally, after he had kind of fished for the idea that, some people don't identify with their body parts down there, and, eventually pushed me until I came out as trans to him, and then called home and told my family that was the root cause of all my problem. No credence to the fact that I had just met my biological father, no credence to the fact that I had a strained relationship with my stepfather who helped raise me, but who is pretty profoundly disabled. And so from there, I started to internalize that idea that medical transition might be a path forward for resolving this distress that seemed never ending. And so I began attending a support group in the DFW area. There were several support groups actually in that area run by the same organization, Transcendence International. And it was at that support group that I met a nurse practitioner who had a transgender adult child and was furnishing hormones to pretty much anyone who came and saw him. And after one appointment at age 17, without ever meeting my real parents or even verifying that the adults who took me were my parents, which they weren't, he prescribed me testosterone and an estrogen blocker, and anastrozole. He facilitated me to lie about my sex on my government documents, such as my license, and I could have gotten my birth certificate changed as well if I had wanted to. And referred me to specialists anytime I would have a complication pop up. If I had vaginal atrophy, it was the gynecologist who was really quick to offer me a hysterectomy. If it was, dizziness and headaches and joint pain, it was the rheumatologist or the neurologist or the cardiologist or the orthopedist. I saw all of those at age 16, 17, 18, 19. And so he too also used endocrine disorder not otherwise specified, I believe it was called, to get these covered by my private insurer. But worse than that medicalization, which happened right before the onset of COVID in January of 2020, led me to begin to explore in that pandemic lockdown the idea of amputating my breasts as a form of treatment for the stress and the distress that the hormones didn't actually absolve, right? Because they weren't actually treating so much as they were adding on to the list of problems I was already experiencing. And at that point, I had seen a therapist who had a trans ex-spouse, and she helped write a totally fraudulent letter, and by fraudulent I mean full of things that were not true, such as my client has lived as a man for the last 12 years, which as someone who was born female and will die female, I had not. But that was especially untrue during COVID, right, when there was no opportunity for me to even go into the public to live life as a normal person or adult, let alone the opposite sex. So she ignored a history of sexual assault that I disclosed to her, and after I stopped seeing her, I ghosted her. She did not revoke that letter, but she did terminate my status as her client. From there, I saw the Crane Clinic in Austin, which I strongly advise being researched. They moved from California to Texas because of Texas, at least in my opinion, Texas's tort reform laws, which make it extremely difficult to sue them for medical malpractice. They told me that they could get my surgery covered in network despite being out of network, so they had like a 90% success rate. Told me alongside listing all the complications I could experience from the surgery that they had never really had any complications like that. And I would later find out after experiencing complications that was because they ghosted clients who had complications. They told me nothing was wrong with me on 3 separate occasions until I ended up in the hospital. And when I asked just, what are you guys gonna do to prevent this from happening in the future? They stopped responding to me after trying to get me to sign a non-disparagement agreement and giving me $400, which I did not take because I wasn't gonna sign that NDA. So I think and I'll wrap it up here, I think the main through lines of my story were ideological ties, right? That center catered specifically to transgender patients, had a lot of really affirming imagery and people laughing and feeling good, kind of like those drug commercials you guys, I'm sure you've seen. There was no differential diagnosis, no exploration of the root cause or interest into why I was feeling the way I was feeling. And there seemed to be this kind of common thread with supporting the whole person rather than what their expertise was and what their specialty was as doctors, not activists. It was like putting diesel in a gas engine for me. I was never given the insight that I was altering a fundamental process in my body, which is my endocrine system. And although I was on 14 different medications when I detransitioned in 2022, I'm now on 2 for Hashimoto's autoimmune thyroid disorder that I think I may have obtained from the testosterone.
Soren, thank you. If I can ask, you mentioned what you're currently studying, and it does seem, as you continue research on this, that the link between access to social media and a lot of the stories we're hearing and transitioning. Right? Are you seeing that as part of your research as well as you're going through that?
Yeah, I'm really interested in that. In particular, I think kids use frameworks to understand how to move through the world. That's why it's important they have parents who love them, right, to show them what kind of adult they could become. And when the internet is doing the parenting, which I don't think often is totally the fault of the parents, like you guys didn't grow up with that, right? You guys didn't see the consequences until our generation had already suffered them. I think it can be really easy to slip into online groups that tell you who you are instead of letting you explore it in an embodied way in the real world through all 5 of your senses and not just this audio-visual matrix that is social media and the internet.
Great. Thank you. Thank you so much. Beth?
Hi, my name is Beth. My ex-husband and I, we got a divorce when our children were young. My daughter was an excellent student. She loved gymnastics and math and reading. She was also creative, sensitive, and sympathetic. At the end of 6th grade, my daughter suffered trauma, and she became withdrawn. In 7th grade, she was placed in an honors class with other gifted students. Some of these students were trans-identified girls. This was 2018 when the teachers and counselors were being trained by the California Teachers Union on ways to support the LGBT and transgender students. In 8th grade, my daughter started seeing a private psychiatrist to help with anxiety and some pretty serious self-harming. At 13, my daughter came out in a letter to her father and me as transgender. Within a few days, we received an email from her school counselor saying our daughter had asked the school to change her name and pronouns. The counselor also put in place a gender support plan that was not disclosed to her father or to me. So when my daughter's 14, she began experiencing some dizziness spells. And so we took her to Kaiser Permanente Davis to meet with the pediatrician on duty. This is a pediatrician who had never seen our daughter before. My ex-husband, in the exam room, referred to my daughter with her new male name and male pronouns. And in an excited tone, the doctor asked my daughter if she would like to have her medical records changed to reflect her new name and her male pronouns. This is the first visit. The doctor then recommended that we take our daughter to the Kaiser Proud Clinic, a pediatric gender clinic in Oakland, where she could meet. It was a one-stop shop where she could meet with endocrinologists, an OBGYN, a gender specialist. So the next day I called this pediatrician and I said, you had no right to suggest to my daughter that she seek medical interventions at a gender clinic when we were just there for a wellness visit. So I asked the doctor, what would you do with someone my daughter's age if she said she wanted to change into this opposite sex? And she said, well, we refer them to the Kaiser Roseville endocrinologist. So then I spoke to the endocrinologist and I asked him, what would you recommend for someone my daughter's age who wanted to become a trans man? And he said they would go to the Kaiser's gender specialist and talk with them about puberty blockers and hormones. And when I said, could she talk, would you talk with our private psychiatrist? He said, no, we prefer to keep all treatment within the Kaiser system. So when I voiced my concerns to the pediatrician and the endocrinologist about what was happening, the endocrinologist said, this is an emerging field. Quote, this is an emerging field, quote, we don't know the long-term medical effects, but with any medical treatments, there are benefits and there are risks. So I asked him what would the benefits be, and he said, quote, it's been shown that youths have a lower risk of suicide and less suicide ideation if they are offered medical treatment. He also said that, quote, youths will feel better when they're on hormones and that they can stop their periods and give them the physical traits of the opposite sex. And the endocrinologist, of course, referred me to WPATH as the leader in this field and to the Endocrine Society. And he also recommended I talk to Gender Spectrum, which is one of these groups that encourages parents and families to transition their kids. Fortunately, my daughter's psychiatrist was willing to have a counseling session with my ex, my daughter and me in the same room, and she explained, because I asked her to, the risks of medicalizing with blockers and hormones. This includes brain development, delayed brain development and loss of bone density. So we agreed, this is when my daughter was 14, that she would not do anything medical until she was 18. So I realized later how fortunate we were that we were able to send my daughter to a private psychiatrist to seek DBT, dialectical behavior therapy, outside of Kaiser, and keep her away from the Kaiser Gender Clinic. My daughter desisted from her trans identity about 4 years later in her senior year of high school. She's now in her 3rd year of college and she's doing great. I just can't imagine what would have happened if, when my daughter was 14, if we had taken her to that Kaiser Proud Clinic in Oakland. You know, the doctors in Davis, the endocrinologists, they were all captured by this idea, and they were disingenuous when they were telling us that it would decrease her risk of suicide or suicide ideation.
Thank you. Thank you, Beth. Forrest?
Yeah, I just want to take a second and thank everybody. So I'm from a little bit of an older generation of transitioner, I think. Kind of sit right on the cusp. My transition was from 2015 to 2020. I'm also, I'm a male, and so one of the things that I think has been happening in our conversations about transgenderism in general is we kind of clump the men and the women together, but there's some interesting kind of patterns, I think, between the two different groups. I don't know if anybody's familiar with Ray Blanchard. He's one of the original sexologists who used to talk about this, and I saw him responding to an interview about ROGD, rapid onset gender dysphoria. There's, you know, in girls, we've seen a lot of the ROGD, and when he talked about the boys, he said, with the boys, he tends to see that it doesn't just come about overnight, that it tends to be something that they've been brewing about for a longer amount of time, and I would certainly say that that's true in my story. Which is, you know, I'm up here, this is for minors, protecting minors. I began my transition at the age of 20. So I didn't fall into that bracket of minors. But I still believe that young men and young people are vulnerable. A lot of times they're carrying something that they may have been carrying since they were a child. I know in my case, you know, when I've sat down recently and gone to the depths of my soul and my heart about this, writing my memoir, Where Does the Story Begin? I go all the way back to the first time I remember my parents, you know, leaving me alone with my sister at my grandma's house. And I just had this kind of thought, this isn't my family. Because I was a child and they left me, my grandparents' child. But that feeling, I remembered that feeling. For the rest of my young adult life, whenever I would feel like I didn't belong somewhere, those were the words that I would remember. I was still brewing on something that happened when I was a small child. And you mix into that dysfunction in the home, sexual abuse, grooming online, pornography, you mix into that, and then you've got a pretty tenacious identity by the time somebody is 16 years old or 18 years old. And I think it's good as a culture that we're talking about this the way that we are now. Because when I think about the young man that I was, I seem to have been really set on a track. And if transgenderism wasn't what it is today, I still probably would have had issues. But as the situation is today, I ended up in the same, you know, the same pipeline that everybody, all the other speakers here ended up in. And so we've heard a lot about that. Mm-hmm. I don't necessarily want to, you know, I can share more about those details, but I'll just stop there if you have any questions.
You know, if you're comfortable sharing, I'd love to just hear maybe a little bit more about the detransition process. What was kind of going through your mind then, and what sort of maybe prodded you to say, I need to make a change?
Well, and this goes back also to the transition is, so I was briefly homeless for 2 months at the beginning of my transition. And during that time, I became enrolled in the Homeless Youth Continuum in Portland. And so my entire lifestyle was supported through this vast network of nonprofit organizations. Some of them are private. Some of them are very good, admirable, noble organizations. I was able to live a really nice lifestyle. Living high on the hog on the homeless youth continuum as a transgender woman. I kind of became an icon. But I aged out at 24. You age out, and suddenly all of those opportunities are gone. And so my transition, I was also putting off the decisions about surgery for those 2 years that I was totally housed. And then the surgeries happened right at the end when I lost my housing, which is kind of the irony and part of the oversight from the medical system is that the surgeries were solicited by social workers in the HYC. There were around me in some of those housings, I wasn't paying attention, but there were detransitioners kind of dropping like flies. And then it was actually, I went into a crisis as I lost my housing that I went through those surgeries. That crisis is part of what ended up bringing me back around to the detransition. I caught COVID and I totally lost my housing in Portland. I went back to live with my parents. And that forced me to look at my family dysfunction, to look at my family and realize there's problems, but it's not as bad as I thought it was. My parents aren't evil people. I can live with them. It forced me to confront things from my past, and then there was also a lot of isolation during that period. So I kind of cut off the trans people around me. There was still a lot of difficulty in receiving any kind of care. I had some counselors suggest that I was still feeling dysphoric because I hadn't had a full vaginoplasty. I had an orchiectomy and I had the breast implants. So I was operated on, and that regret is part of what shocked me out of it because it wasn't what I had intended going into the transition. I hadn't thought that far ahead. So it was gradual. I have daily journals from that period, and it took months to unwork first I acknowledged that I regretted it, and then I acknowledged that I regretted it before I believed that I was a man. I still thought that I was a trans feminine person, and I regretted it. So I had to unwork layers and layers. I took years of therapy. I found a forensic psychologist that was a specialist in men's sexual issues. That was a smart move. It took years, and it took years to get back into the workforce, to bond with my family. I mentioned writing the journals, but I had a beautiful moment with my grandparents. I thankfully was able to reconnect with my grandparents in the last year of their life. Wow. Both of them passed away within a year. And I had a beautiful moment out on the farm with them where I actually had this very clear thought where actually this is my family. That's my grandpa. That's my grandma. So the detransition, it's been 5 years now, and it takes a lot to rebuild your whole life when it's not just the medical damage, it's a much deeper social damage. It's a damage to your whole sense of being, right? You build wardrobes, you build a whole life, you build all your papers, everything. You have to change all of that. It's a real deep hole.
Wow, thank you. Thank you for sharing. Helen?
Hello, everybody. Thank you very much. I'm going to read my statement because I'm not that great at this. When my son was 3 years old, my ex-wife, with the help of medical and school professionals, put him firmly on the transgender path. In the fall of 2014, my son's preschool teacher informed me that my son wanted she pronouns. This happened only 1 month after the traumatic dissolution of my marriage. At that time, I had joint custody, and it became a constant battle. I shared with everyone that my son did not express any of these preferences to me. I wondered if he was trying to gain more attention from my ex, and if she was using gender to split his loyalties. None of this seemed authentic, but every time I posed reasonable questions and expressed curiosity or doubt, I was looked upon with suspicion. Overnight, I became the dreaded non-supportive parent. At the same time, my ex engaged constantly with school providers and medical professionals, and she demanded that her family and friends support my son's rebirth, as she called it, as a transgender girl. The gender-affirming model does not welcome questions and inquiry. Repeatedly, I was told by almost everyone that I must accept my daughter, that not accepting the utterances of a 3-year-old was tantamount to abuse and would lead to self-harm. It made no sense. I was now in a world where up was down and down was up. It was a time of unrelenting despair. I could not eat, I could not sleep, I barely functioned at work. My unwavering love for my son was all that really kept me from giving up. I was ignorant back then regarding gender ideology and the medicalization of minors. I was frightened and vulnerable. I needed help. I made an appointment to see Gender Management Services, GEMS, at Boston Children's Hospital in 2016. I brought my son to GEMS 3 times. Initially, I went with my ex, but as we became less and less aligned, we attended separately. We saw Dr. Amy Tishelman, a clinical psychologist and the director of research at GEMS, once yearly in 2016, 2017, and lastly in 2019. For 4 long years, my son lived as a boy with me and as a girl with everywhere else. The situation was traumatic for both of us. I was constantly worried about the effects on my son of being torn in 2. At one point, I even tried to use the girl's name, but I couldn't do it. I just could not participate in the charade. Over the years, Dr. Tishelman noted time and time again that there was difficulty in parsing out the impact of the parents' conflict on the child's gender presentation in each home. Even with the documented uncertainty of my son's presentation, Dr. Tishelman at one meeting coerced my son to convince me to go along. Her notes are quoted as thus: "Following my meeting with Rosa, I met with Ms. Spiegel and her partner, and again with Rosa's permission, shared that Rosa told me she'd like them to refer to her as Rosa and use female pronouns. Rosa agreed to come into the room, and all 4 of us met together. At this time, Rosa reiterated to her mother and partner that I want to be called Rosa and I want to be a girl. My wife and I were stunned, but smiled, and the meeting concluded. My son was 6 years old, and within the gender affirmation model, he and the therapist were in complete control. At the final visit in 2019, Dr. Tishelman had my son fill out a gender worksheet, assigning numbers to how he felt. Tishelman's conclusion was that today she reported that she's not a boy or a girl, but something different. Again, there was ambiguity, but she dug in deeper. Dr. Tishelman advised us that we should start thinking about puberty blockers for Rosa. Finally, I sued for full custody. Things were moving at breakneck speed towards medicalization, and I had no other recourse. At the trial, Dr. Tishelman was called to testify. My ex had Dr. Michelle Forcier as her expert witness, and she also testified. Dr. Forcier is a pediatrician affiliated with Hasbro Children's in Rhode Island. She is possibly better known now as the Chicken Lady in the film What is a Woman? It is documented in the court findings that Dr. Tishelman cautioned that failing to strongly support gender-diverse children can lead to suicidal ideation and attempts. This, of course, has never been proven. At the same time, Tishelman also testified there is insufficient research around socially transitioning children and that there are differing opinions. Dr. Forcier also agreed with Dr. Tishelman that there was insufficient evidence. The court findings state, in Dr. Forcier's own words, research on gender dysphoria is in its infancy. At my trial in 2019, both these experts in their fields admitted to poor evidence. It is chilling to recount that during our visits to GEMS, Dr. Tishelman repeatedly advised the importance of accepting Rosa and ultimately suggesting the use of puberty blockers while failing completely to admit that evidence around social and medical transition of children was sparse. My son was never gender dysphoric. My son was never transgender. It was all a lie.
Helen, thank you so much. Thank you for sharing that. Gwen?
Sure. Hi, my name is Gwen Turacki, and I'm a mom from Michigan. My son was around 14 when he sent me a text that he was a girl. And at first I thought, hey, he's at theater, and they're just dressing up like girls. The next text was HRT, and I meant that as cross-sex hormones. At that time, I dove into research. He was away, so I was able to jump on the computer. I have a background in library and information science. So I found Dr. Grossman, I found Jennifer Billick, pro-trans sites, anti-trans sites, and crucially, parents with the inconvenient truth about trans. I connected to other parents and quickly realized this is a cult, and guided my son out using proven cult techniques. Basically what I did is I leveraged stuff that was out there for other cults and tailored it to the needs of my son. We navigated the depths of the transgender ideology, starting with his pediatrician's office. And the reason why I did this is my son and I have a very close, loving relationship, and he would expect me to follow a protocol. So we went to his pediatrician's office, who referred us to the University of Michigan's Mott's Children's Hospital Gender Clinic. Notably, the pediatrician that we referred to is not his normal doctor. This is at a different children's hospital. She was in the process of transing her teenage daughter. And it's like, okay, jump down the rabbit hole, here we go. At Mott's Gender Hospital, because I did make an appointment, because according to the protocol to get someone out of a cult, you slow walk them and bring your kid closer. My kid and I were always very close, but we have a common bond around music. We did more, crate diving for albums together because we're into that stuff. So at the Mott Children's Hospital Center, there's a 3-hour session with everybody all together. So his father, my son, and myself. The therapist explained that the purpose of the session was to help our child connect to what was happening with his mind and align his self-image with his body, citing WPATH as a standard of care. When I asked why, there's a 4,000% increase in the number of trans-identifying girls in the UK, I was told society's just becoming more accepting. Amazing. She explained that Western societies have become more accepting in the ways of thinking. Please note that my son's father immediately affirmed and aligned with the therapist. I sat in the office and I listened to her weave a narrative not based on biological reality, opening the door of possibilities of changing physical appearance without even considering underlying conditions like going through puberty during COVID lockdown. Basically, these kids' social fabric was ripped upside down. The second hour was with my son alone, and I was unable to question the session due to patient confidentiality. The third hour was all 4 of us together again, the therapist, and she kept on saying to my son, I feel like there's something you need to tell us. She was coercing my son with self-doubt. So I recognized this as, like I said, coercion, and began to steer the conversation away, asking for next steps. What do we do next? And after a single 3-hour session, she said, hey, the next step is let's contact the endocrinologist. That's when I shut it down. And I turned to his father and my son and I said, we're going to talk about this at home. I needed to control the situation. Seriously, it was like Alice in Wonderland. It was crazy. The rest is history now. And now I have a thriving, healthy 17-year-old man with an exceptionally bright future. My son was tested for talented and gifted and had that trajectory. Had we followed the path set by the University of Michigan's Mott Children's Hospital, The story could have ended tragically. My son is exceptionally talented and gifted, just like Elvira's daughter. Thank you very much.
Gwen, thank you for that. If I may ask, that subsequent step, that conversation at home with your son, was that a sort of one-time thing that you were able to? Was that a months-long process? Is there anything you could share about that?
Sure. Okay, so that really didn't happen because I wanted everybody to go into neutral corners.
Yeah.
And because his dad was affirming, I had to walk that fine line.
Yeah.
So anyway, the slow walking, also bringing closer. About 3 months after that visit, I walked into and I was feeling him feel less stress because I think part of it is that he felt heard. So about 3 months after I walked into his room, it's like, hey, hon, what are your feelings about cross-sex hormones now? And he said, Mom, that's like putting lipstick on a pig. My heart leapt, okay? But we weren't quite out of the woods yet, right? So fast forward perhaps another 4 months, he walks into the kitchen. Granted, at this point, my kid's like 6 foot, I grow him big. And he says, I'm thinking about growing a mustache. What do you think, Mom? And I'm like, that's a great idea. Inside my head, I'm doing backflips, going, we made it. And so after that, I help coach other parents, other pit parents. I have parents in South Africa, Australia, thanks to ACTS, it's easier to do that. There is a way to get your kid out of this.
Thank you. If we could just do one more round of applause for everybody out there.